bow and string. This is so what would you call a horse in this standing position? What do you call this?
Oh, what is called?
That is a
Rearing.
Is it a goat?
They're rearing, right?
Yeah, it's called rearing. Exactly.
So I was like, give me a minute.
So it's called, when they're standing on their hind leg, it is called rearing. And horse behave this way where they are frightened or excited, aggression, or where they are trying to exhibit disobedience. You don't want you to ride them, or when you have a non-experienced rider, they behave this way. Sometimes when they are in pain, they also exhibit these. So it's not a desirable effect. There are some trainers that help to train horse to avoid this type of. So it's a behavioral thing. So in order to understand the anatomical concepts, we will call these bow and string, and this will be our bow. So it's called this is a bow, and the string here. So here we're interested in those anatomical structures that assist or play a role in this behavior. We have, for the bow, we are going to list the thoracolumbar vertebrae. Thoracolumbar. So when we say thoracolumbar, we mean the thoracic vertebrae, lumbar vertebrae, and their articulations. And we will list the ligaments. I'm sure we have seen these ligaments when we were talking about the muscles, the bones of the vertebral column. And here we will also list muscles of the epiaxial, hypaxial groups, that is axial muscles, so we can call them axial muscles generally. And for the string, so this will be this, and then mainly abdominal muscles. So when there is contraction of abdominal muscle, when it contracts, it will flex the bow. It causes flexion of the bow. So here, largely we are talking about epiaxial, to a large extent, epiaxial muscle. Yeah. So the reason why I try to focus on the epiaxial here, because sometimes the abdominal muscles are also classified as hypaxial muscles, or even the muscles of the thoracic wall as well. So contraction of this muscle, our focus is going to be on this muscle because of course this doesn't contract and all that. So contraction of this muscle is going to strengthen the bow. So when this contracts, it will strengthen. It strengthens the bow. So the weight of the visceral organs here, you have visceral organs that have attachment to the dorsum, the dorsal wall here, and the pull of these abdominal organs also helps to strengthen the bone. So this behavior will mean relaxation of the abdominal muscle and contraction of the epaxial muscle. Relaxation of abdominal muscle and contraction of the epaxial muscle. And the reason why I try to bring in together the thoracolumbar vertebrae, the ligaments, they act together with these muscles, the epaxial muscle, to bring about this rearing position. So inability to rear, yeah.
So it's just the epaxial muscle, it's not the hypoaxial muscles, it's just.
Yeah, the
Okay.
epaxial.
Thank you.
So the thoracolumbar fascia. So we have talked about thoracolumbar fascia before. So whatever we say then is exactly what we are still saying here. So we have superficial and deep, and we are going to come across some of them again as we progress. So generally, when we say hypaxial group of muscles, we are talking about muscles of the lumbar region, muscles of the abdominal wall, muscles of the thoracic wall, muscles of the neck. So in the course of our discussion, we have seen this and this. So meaning this and this is done. So our primary focus here will be this and this. And again, during the dissection, these are the two muscles that would primarily focus on because these are internally seated, and when we come to look at the abdominal cavity, then hopefully we'll be able to review these muscles again. So this means if you come back here, this means that this has been cancelled, this has been cancelled, this has been cancelled, and we just have this primarily to look out for. So longus coli and longus capitis. So longus means long, longissimus means longest. Longus means long, longissimus means longest. Coli means neck, capitis means head. So this is long muscle of the head and long muscle of the neck. long muscle of the head, longus capitis, long muscles of the neck, longus colli. So I know this might look different from what you have. I'm using the same picture, where I felt that this have a good view of the picture of the longissimus or the longus capitis compared to the previous picture, the one you have. So I think I sent one of these pictures in class. If you don't have it, you can, I believe, has he shared it with you?
I think it's on the side.
It is.
Yeah, it's on the previous slide, so you can just reuse it. So the longus capitis comes all the way from the transverse processes of C2 up to C6, transverse process. And this, the reason why it is called longus capitis is because it inserts on the head above the basi occipital. It inserts on the basi occipital, or the base of the occipital bone. So here we have the skull, and we have the frontal bone, the temporal and parietal bone here, and we also have the occipital bone here. So this is the bone that we refer to as the occipital bone. So next semester, the end of this semester, next week, please return the bone box to me. And next semester, when you resume, you have one of these and the mandible as well. So this is where the occipital bone is. So the occipital bone has several aspects: the squamous part, occipital condyle, paracondylar process. So this is the base of the occipital bone, referred to as the basi occipital. So this is the base of the occipital bone. This is what we refer to as the basi occipital. So this is the reason why this muscle is called longus capitis, because it have its insertion on the head, that is the basi occipital of the skull bone, on the ventral aspect of the skull. So what will happen if this muscle contracts? So it's going to bring about ventral flexion, or lateral flexion. Ventral flexion or lateral flexion. So ventral flexion is due to bilateral contraction. Ventral flexion is due to bilateral contraction, and lateral flexion is due to unilateral contraction. Unilateral contraction. So here we have muscle here and here. So when you have both of them contracting, then you have ventral flexion, and lateral flexion is when you have one of the muscle belly contraction So this is the longus capitis. From our dissection, muscles of the forelimb. Which muscle do you think that is superficial or will be superficial to these longus capitis?
Sternocleidomastoid.
Omotransverse, sorry.
Oh, yeah.
Yeah, so Omo, come here. Omo, come here, go this way. So here again we have the muscle attaching to the base. So this is the basi hospital, number 5 here, basi hospital. And here we have this muscle attaching to the base of the hospital bone here, that is the longus capitis. The longus coli, this muscle is very important when you are performing surgery related to the intervertebral disc, related surgery, because here is the intervertebral disc is readily accessible here, and the muscle that need to be reflected to expose these vertebral discs will be the longus coli. So this must be reflected within the neck region here to expose the cervical intervertebral disc. So you can see here that we have several muscle fascicles. So these are overlapping. They are overlapping muscle fascicles. Muscle fascicles. So we have this muscle coming up to this. That is, it is seen, or it occupies the cervical to the thoracic region, extending from C1 to T6, C1 to T6. So transverse process, origin is the transverse process. And insertion is C1 to T5. Insertion, vertebral bodies. Vertebral bodies. I hope you know what a vertebral body is. Vertebral body. You say what? We don't know what it is.
Did you ask a question?
Yeah. I said I hope we know where the vertebral body is.
I hope so.
Just
don't answer everything we've been through. Experiences seriously. I better know, but
So this means that it has a short course. It has a short course. So what will be the action of this muscle? Ventral flexion, bilateral action, ventral flexion. So they have a similar action with the so during the dissection, we will see two muscles, one and another one here, and one here and one here. We are not going to expose the entire muscle fascicles, but just a particular segment where we'll be able to see them. So these on the lateral side will be the longus capitis, and this on the medial side will be the longus coli. So this means that the longus coli is deep, whereas the longus capitis is lateral. So it is related to the esophagus. So these are the other muscles, the psoas major, iliacus, quadratus, lumborum. I believe that we have seen the iliopsoas to a little extent when we were talking about the femoral nerve. So we are not going to worry about this muscle. Hopefully next semester when we dissect the abdominal cavity, we'll be able to see this muscle pulsing. And we'll be able to see this muscle as well. So you can see this retractor muscle. This is internal and this is subcostal muscle. These are subcostal muscle. Most of the thoracic wall, which we didn't bother to talk about. So, hip axial muscle. So we are going to see this muscle, each and every one of them. And again, we want to focus mainly on this and this to a large extent and this to a very little extent. So the reason is because this has several multiple branches. So the hip axial group are arranged in a parallel fashion. So this is a cross-section view. So they are arranged in a parallel. They are parallel to one another. So let's see. This. This. And this. So which one will be the most lateral?
Costalis.
Iliocostalis.
Yeah.
Which one will be the most medial?
Trans.
Yeah, transversus spinalis system and longissimus system is intermediate. So we'll say that these muscles are arranged in a parallel and longitudinal fashion. So they are parallel and longitudinal. They have a longitudinal placement. So we'll start with the most lateral, which is the iliocostalis. So we call this iliocostalis because it extends from the ilium to the ribs, which is the costal. So this is why we call this iliocostalis. So this iliocostalis and other epaxial group of muscles are arranged longitudinal, and also they are paired. So what we have here, we also have on this side as well. And we have mentioned that they are arranged in parallel. They are also longitudinal, and this word also applies to all three groups. So they are also paired, and they are arranged in they are arranged in fascicles. So this means that we don't have a single muscle running across. So you can see them in different segments or fascicles. So these are what we refer to as fascicles. And we can say that they are lateral, they are extensors or lateral flexor. They are extensors or lateral flexors. So the iliocostalis has two muscle fascicles, that is the iliocostalis lumborum and iliocostalis thoracis. So the iliocostalis lumborum, these extend from the ilium towards the lumbar region. Then iliocostalis thoracis extends towards the thoracic region on thorax. So this is the iliocostalis thoracis. So these are the two muscle fascicles that we have. So they are associated with the ilium and the ribs, that is the costal. That is why they are called iliocostalis. So iliocostalis lumborum originates from the wing of the ilium. So it has the intermediate muscle, which we are going to look at later, that is the longissimus. So it has similar origin with the longissimus. So this is the longissimus, and this is the iliocostalis here. So this muscle causes cranially to insert on the transverse process of the lumbar vertebrae, all the lumbar vertebrae, transverse process. And it also inserts on the proximal aspect of the last four ribs, sometimes up to the fifth rib, but we can say fourth or fifth ribs, last four or fifth, 5 ribs. So during the dissection, I have seen a lot of students trying to separate these two muscles. Please don't do that. They are fused together. The only demarcation or point of separation between these two muscles is a groove or area of depression between these two muscles. So you don't separate them. Their muscle fibers are fused. So it fused medially with the longissimus within the lumbar region here. But so this fusion, the point where the iliocostalis and the longissimus muscle fuse, is what we refer to as erector spinae muscle. Meaning muscle that aid in standing erect or standing upright. Erector spinae muscle. They play a very significant role in standing upright or standing erect, so that is why it's called erector spinae muscle. So they try to reinforce the absence of the thoracic vertebrae or the ribs here. Since the ribs is absent here, so this muscle connects the ilium to this lumbar region here. So this fusion reinforces this region and aid in upright standing. However, they are separated cranially. They go their separate ways. So this is longissimus and this is iliocostalis lumborum. So this muscle contracts to bring about extension of the vertebral column. So it's the same concept. Bilateral contraction brings about extension. Unilateral contraction brings about lateral flexion. So it's important to always put the word lateral flexion, because when you mention ventral flexion, then you are talking about the hypaxial group of muscles. So what will happen to these ribs if this muscle contracts? Caudally towards the body.
Mm-hmm.
So by so doing, this muscle will also aid in expiration, and we will also say that it is innervated by the dorsal branches of the spinal nerves within the lumbar and thoracic region. So, as soon as we reflect the skin within this region, we won't be able to see this muscle until we take off the thoracolumbar fascia. So these muscles are covered by thoracolumbar fascia. So what will be X and Y? X iliocostalis lumborum, Y longissimus. So you can see the groove between them. That is what differentiate or demarcate between these two muscles, or else they are fused, their muscle fibers are intermingled or intertwined, and as they cross cranially, they go their separate ways. So we have the iliocostalis thoracis here. and iliocostalis lumborum here. And here we have the longissimus system. So here we have aponeurotic attachment here. I think it is more visible here. You can see aponeurosis. These are aponeurosis. So it's the characteristics of these muscle. Very thick aponeurotic attachment. So the iliocostalis thoracis, this will say that it is long and narrow. Iliocostalis thoracis will say it is long and narrow. We have iliocostalis thoracis here. Let's see if we have where this extends from is starting from 12th rib. If this is 13th, we'll have the starting from the 12th ribs and up to C7. So extends between the ribs. It overlaps the ribs as well. So by way of origin, we will say that these the second rib to the 12 ribs, this will serve as its origin, and this will serve as its insertion. So action, bilateral contraction, extension, unilateral contraction, lateral flexion, and this will also aid in expiration. And it is innervated by dorsal branches of the thoracic spinal nerves. So these are pictures of, yeah.
Sorry, did you say that was expiration or inspiration?
Expiration. When it contracts, it pulls the ribs caudally towards the body, thereby aiding in expiration. So it is good to be able to take note of these aponeurotics. It's helped a large extent in helping to identify these muscle. The longissimus system so the word longissimus, we say, means longest, and you'll see this word might thinking what that is, whether it is a mistake. No, it's not. It's longissimus thoracis et lumborum. This means and. So if you like, you can replace it with the word and. So longissimus thoracis and lumborum. So this extends from the ilium to the head, It has three major divisions, and we have the capitis around the head. We have cervices around the cervical region. And we have the thoracolumbar region around the thoracic thoracolumbar region. So this is 1, 2, 3. So these are the three major divisions of the longissimus system. So what will be the relationship to transversus spinalis and iliocostalis? Transversus spinalis and iliocostalis, what will be the relation?
Transversus spinalis
Is what?
What's the longest one?
Is what?
You said what was the question again?
What is the relationship of longissimus muscle to transversus spinalis and iliocostalis?
Oh, it's intermediate in between both of them. Longissimus is in between.
So how would you describe the relationship of the longissimus to the transversus spinalis?
Lateral.
Yeah. What about the iliocostalis? Medial. So recall we mentioned that the longissimus has similar origin with the iliocostalis, that is the wing of the ilium. So this comes all the way from the wing of the ilium and the spinous processes, wing of the ilium here and spinous processes here of the lumbar and thoracic vertebrae. So here we are looking at the longissimus thoracis et lumborum. So longissimus thoracis et lumborum has its origin from the wing of the ilium. The wing of the ilium, the spinous processes of the lumbar and thoracic vertebrae. So all those processes we mentioned, the transverse processes, articular process, cranial articular process, mammillary process, etc., they all serve as the insertion. So I will say that these insert on the various processes of the lumbar and the lumbar vertebrae, thoracic vertebrae, and also the ribs. It has a characteristic dense aponeurosis. And we have also mentioned that a groove demarcates or differentiates these muscle from the iliocostalis and the at the erector spinae region. So this muscle is innervated by the dorsal branches of the thoracic and lumbar spinal nerves. So we have seen the longissimus muscle around the thoracolumbar region, and here we have the longissimus muscle around the neck region or the cervical region. So this is triangular in shape, and it has about 4 muscle fascicles. So the spinous processes of thoracic vertebrae serve as its origin, and it inserts on the transverse processes of C3 up to C6. Transverse process, from spinous process to transverse process, from spinous process of thoracic vertebrae to transverse process of cervical vertebrae. So this will help to extend the head and neck, to help to extend the head and neck, and also lateral flexion of the head and neck. So these will also be innervated by the dorsal branches of the thoracic and cervical spinal nerves. Longissimus capitis. This is the most cranial portion of the longissimus system. So this comes all the way from the transverse process of T1, T3 to insert on the mastoideus part of the temporal bone. So this is a temporal bone here, and we have the squamous part, we have the process, and caudally here, this is where we have the mastoid, the mastoideus part of the temporal bone that also provide attachment for cleidomastoideus. So these muscle inserts on the mastoid. Some will call it mastoideus of the temporal bone. So the temporal bone is a bone of the skull, which we will be looking at next semester. So it has a similar action with other parts, that is the cervical part, that is extension of the head and neck, and lateral flexion of the head and neck, and it is also innervated by the dorsal branches of the cervical spinal nerves. So this shows the distribution of these different muscle fascicles of the longissimus system. So let's see if we can look at some of the transversal spinalis. So the transversal spinalis, there are several group of muscles that form the transversal spinalis. We are not going to look at all of them, just pick a few and talk about them, and the reason we don't want to mutilate our cadaver during the dissection. So we are just going to focus on few, and we'll put a full stop for the semester. So let's take a 10 minutes break and